Hey everybody, Dr. Dave Marquis here, and I wanted to share with you some thoughts about something that I observe in many children when we're working with them for neurodevelopmental processes. The thing that I wanted to focus on today is often referred to as toe walking. And you'll see this often in kids where they fail to let their heels actually strike the ground. It kind of looks like they're trying to look up over a counter. You know, they're standing on their tippy toes, but they literally walk that way. That's very common when you initially start walking, but that should be gone by the age of 2 to certainly no later than 3. And if you see it in place after 3, then there's a high probability of other neurodevelopmental concerns that will arise. There's a very strong correlation with that observation and then ADD, ADHD, and even autism spectrum symptoms arising as they get older. So you would start to see those emerging 4, 5, and 6. Why do they do this and why does it happen? Well, to understand that, I'd like for you to refer to the whole concept of proprioception. And we really are proprioceptive creatures. What is proprioception? Well, that's sensory input. If you've ever taken the time to look at a brain map, I would encourage you to actually go online and Google homunculus. It's quite a word, and it's quite an image when you look at it. It's how the body is laid out on your motor strip. So up here in our parietal lobes, which are directly up above your ears, you have a map of your entire body, and in neurological circles that's referred to as a homunculus. Well, you'll notice that the feet, the hands, the lips, and the tongue are gigantic. They're really large relative to the rest of the body parts because those are where your senses largely exist. Infants, as they're growing, well, that's their world. You know, they're touching and tasting everything because that's how they're learning. They're literally learning about their world as they stick their mouth on that counter and rub it around or grab your fist and stick it in their mouth. You know, they're learning. As they learn, if their nervous system is developing in a normal fashion, their motor skills will start to integrate as well. But sometimes they don't get adequate input or other things interrupt the process. And there's a lot of hypothesis and conjecture as to the things that might interrupt neurological processes, whether it be viruses, environmental stressors, and some of those environmental stressors can fall into the things that get injected into kids. Some of the environmental stressors might be medications that they use, some of the things that they're consuming or exposed to in terms of microplastics and other environmental toxins, whether it be pesticides, herbicides, you name it. So there's a lot of different stuff that we as humans are exposed to that might interrupt neurological processes. And then there's this whole aspect of coming to the table genetically predisposed. And yes, that's very real because much of the things that we observe, particularly in the autism spectrum, are actually starting in utero, where neural migration is following an atypical pattern, and then all it really needs is an additional external stressor to start to show up as a symptom that you might observe as one of these neurodevelopmental conditions. Toe walking. What does that imply? Well, it implies that that individual is either trying to overstimulate themselves by using those toes, just like you might see a child stimming. This is another way that they can get some stimuli in to talk to that part of their brain to help to release dopamine to satiate them in the moment. And then the flip side of that is they're actually masking a chunk of the foot in terms of its input. So the ankle is a very proprioceptive joint. There's a lot of input that can come from the ankle as well. But when you elevate that heel and you contract your calf, it literally starts to shorten the Achilles. And interestingly, this is kind of a side note, but directly related. The traditional route for helping toe walkers is to wait and see if they grow out of it. And if they don't, then one of the common suggestions is to operate and cut the Achilles to allow it to elongate and put them into a boot so that they can stretch it out, rather than changing the neurology to allow the muscle to elongate. And I'm like, wow, that was bass-ackwards. That is not the approach that I would encourage anyone to initially take. Right? you hear these things and it makes your mind want to explode. Because if you truly understand the neurological pathways that lead to it, it just stands to reason that, okay, if I can work that backwards and help this person start to engage and plug these wires back together, those muscles are going to respond. And they do. That's the beauty of brain-based therapies and the neurological work that you can do with a human being. You have children that really don't like sensory input. They might just hate that tag on them, or they can't stand to have things on their arms so that, they want to walk around even in cold weather with virtually no clothes on. And you're like, why do they do that? Well, they have a hard time with proprioception. They're having a hard time integrating that and understanding that neurologically, and so it becomes an irritant to them. Toe walking is a manifestation of that. When you're looking at some of the things that we call primitive reflexes, there's two that are very common for individuals that are toe walkers. One is called the tonic labyrinth, and another one is called the spinal galant. Now there's several other primitive reflexes that can be involved, but those are the two most common ones involved in toe walkers. And other things can manifest downstream in individuals that don't remediate those primitive reflexes. And that's the benefit of understanding primitive reflexes, because you can kind of see into the future of that individual as to what the world might hold for them if they don't change those neurological behaviors. Whether that be learning disabilities, the ability to socialize, the ability to function athletically, which is a really common one for the tonic labyrinth, because it often implies that that individual is going to have poor muscle tone. And you'll see this in kids who are toe walkers. Not only do they tend to have poor focus as they get older, but they'll tend to have a lack of spinal tone. And so as a byproduct of that, athletically, they may struggle. If you simply work with them neurologically to help to reintegrate that, not only does the toe walking change, but the spinal tone changes, and now they get back on track so that they can integrate and be social in an athletic way as well, if they desire. What I would encourage you to do is get in touch with a functional neurology practitioner, someone who is trained in brain-based therapies. You'll find this in the chiropractic realm, in the OT realm, in the PT realm, but find somebody who is well-versed in primitive reflexes so that you can properly evaluate your child who may be a toe walker and have the education provided as to how to remediate that, because it's actually a lot of fun. There's so many different simple exercises that you can integrate into a daily activity with your kids that, done over the course of a few months, you'll be amazed at the changes that will occur in their nervous system. And then their ability to literally grow out of toe walking will become a reality. I hope that's motivating to take the time to investigate some of the concerns that you might have with your own kids, or those that you know that might fall into that category, and realize that there are answers. And they don't all lead to a surgery. So I hope that motivates you. Have a great day and be well.